whoever here is right now, welcome to all of you for this session. Please unmute your mic so that we can have better interactions. If you have any kind of questions or queries, you can directly ask me. So check your mic properly. So today's main discussion is regarding how to build your career, your medical career in UK. And why specifically UK? Because we have other options. Yes, we have for IMGs that are in for international medical graduates. We have options for Australia. If you can pass AMC exams, good. We have options for US MLEs. We have options for Canada. But the thing is that all of these countries are already superly saturated. Superly saturated. So the chances to get into a residency program is very narrow. However, due to Brexit, as you know that England have exited from the European Union. Now there are lots of opportunities for doctors, especially the job market for doctors have become much more wider in UK. So it's a very, I think, a very good opportunity for IMGs to grab this and utilize this situation. Just to let you know that in the last 6 months, there have been many IMGs who have appeared for either PLAB or Mrcp examinations and successfully have joined the NHS UK, that is the National Health System of UK. And the process of doing so is quite easy, but the thing is that most of us don't know how to proceed here. So in today's session, I will first discuss about Mrcp and then I'll go with PLAB. So me, myself, I have passed already Mrcp part 1 and unlucky and unfortunate because of the COVID condition, I could not proceed further with part 2 and PACES here. Now these Mrcp exams are basically known as membership of the Royal College of Physicians. Okay, so there are several kinds of Royal Colleges. We have Royal Colleges of England. We have Royal Colleges of
people waiting to join.
We have Royal Colleges of Edinburgh. Okay, please just let me. Okay, we have just received a notification.
Check sometime. I'm talking. Please check in a while. There will be people waiting to join.
Yeah, but there will be notification, isn't it?
I don't think so. Yeah. Thank you. Sorry to interrupt.
2 people. Okay, there are 2 people waiting. I'm allowing all of them. Okay. Okay, hopefully they have joined. Yes, everybody has joined till now. So we were talking about Royal Colleges actually. Now, as I've already told you that there are 3 Royal Colleges mostly. We have Royal College of England, we have Royal Colleges of Edinburgh, Scotland, and also there is one in Ireland. However, collectively, now they have set up an examination called Mrcp UK. So all the Royal Colleges actually acknowledge this qualification here. Now, Mrcp, this exam is considered as an entry examination for training post in UK. So when you pass this examination, you can directly go into core training, also known as CT, core training 1, 2, and then you can proceed with specialization. But do remember that Mrcp exam, according to my advice, is for those who have at least little bit of experiences clinically. Let's say at least 2 years of clinical experience. If those people are willing to do jobs in UK, then they can proceed with this pathway. There are 2 pathways basically. One is our Mrcp pathway, the other one is our PLAB pathway. I'm now discussing Mrcp pathway. Later on, I'll also discuss about the PLAB pathways here. Now, for the Mrcp exams, as I was saying, that I will advise anyone who have at least worked in the hospital for 2 years and gain some experience and knowledges, they can proceed with this examination. Because compared to PLAB, Mrcp is quite difficult. Unlike the PLAB, the percentage of passing in PLAB is also quite higher. Remember that compared to Mrcp. On average, only 45 to 48% candidates pass this Mrcp exams here. Now for MRCP exams, as you can see here in the screen, we have 3 examinations basically. There's part 1 examination, part 2 written, and then we have something called PACES, P-A-C-E-S, PACES, practical assessment of your clinical examination skills. The part 1 examination is consists of 2 papers, okay, and you will have 100 questions in each papers. Similarly, part 2 also consists of 2 papers and made up of 100 questions. The part 1 that we have, this is basically done mainly for those doctors who want to join in the training post. For example, you have done your graduation, medical graduation, you have done your internship and post-internship, okay, that is post-graduation. For post-internship, you are assessed on the basis of this part 1 examination. So usually one of the requirements or eligibility to sit for part 1 examination is that you must have completed 12 months of your postgraduate experience or employment. That is, after you have graduated, you have got your MBBS degree, and then you have worked for 12 months, then you can sit for part 1. That is what is advised to the candidates. Now part 1, as we were discussing, basically will take place in 1-day examination, and it will have 2 papers, each consist of 3 hours. Each of these papers will be having 100 questions. Among these questions, you have to choose the best option that you have. So among 5 options, the best options that you have to choose. Do remember that these part 1 examination do not have any questions regarding images. For example, they will not give you a chest X-ray image or an ECG image and will tell you to diagnose or to find the abnormalities. No such things are seen in part 1. Basically, part 1 will not test or assess your basic knowledge of diagnosing a particular condition, management, and all kind of this similar kind of things. So basically, you see, this is the syllabus for your part 1 examination. For part 1 examination, you can see here, as we have 2 papers, and each paper will have 100 questions. So in total, there will be 200 questions. And the number of questions, the breakdown is given here, as you can see here. So mostly there will be basic questions regarding your basic knowledges. Around 25 questions will come from your basic medical science. Similarly, we'll have questions from different specialties such as cardiology, gastroenterology, neurology, and so on. In total, this is the breakdown of the contents of the part 1 examination. But do remember, there can be slight alteration in this number of questions. It don't have to be exactly that particular number of questions for each specialty. It will vary from time to time. Now, for most candidates, they have problems in scoring marks mainly in the following contents. I'll tell you which one they have problem with. Number 1, they will have problems with mainly clinical sciences. Usually, the candidates scores very less in clinical sciences. Why is it so? Because this is mainly taken by those candidates who have already